Hi, my name is Jun, and I'm a research officer at EpiCentre Massey University. As you all may know, this is the first of our seminar series to present the recent achievements of EpiCentre. Before we start, please leave your email account address in the chatting space if you want to receive info about our next seminar directly. Today's speaker is Dr. Art. After finishing his PhD and postdoc, he joined EpiCentre in 2017 as a senior lecturer. Since then, he has been leading international projects focused on transboundary diseases such as FMD and ASF in the Southeastern Asian and Pan-Pacific countries. Today, he will present a recently completed FMD control project conducted in Laos and Myanmar. Dr. Art, please proceed.
Thank you very much, Jun, for your introduction. I hope you can hear me. All right, good. Let me share my presentation. Can you see my screen? Yep. Okay, that's good. So, yep. So today, I will present the work that we just wrapped up, which is the New Zealand Fund Risk-based FMD control project, right, which focus on the Lao PDR and Myanmar. Just like to go through the project with all of you. So the background of this project, this is the project that's funded by the Ministry of Foreign Affairs and Trade in New Zealand through the World Organization for Animal Health, which is WOHA, or the previous name as the OIE. And the project focused on the ASEAN regional strengthening FMD control in Southeast Asia, with the project period starting in September 2015 until recently May 2022. So the project started with the previous director of the EpiCentre before I joined the team, and it started with the work by Professor Tim Carpenter and Professor Cord Hoyer at the time. And the main aim is that to help the target country to progress through the PCP FMD progressive control pathway to develop a sustainable long-term FMD control in those two countries and also help the region. So basically, the expected outputs of the project, there are 5 main outputs that I will go through each of them. Basically, the output 1 is to look at the FMD risk assessment conduct in the target areas, which is the 2 countries, Lao PDR and Myanmar, and use that to develop the control strategy and implement for the target areas through the vaccination campaign and awareness campaign, and also do a capacity building like training and provide technical assistance, and also coordinate the workshops and provide the resource materials for the countries, and also do the monitoring of the FMD and also develop the modeling tools. So just to give you an overview background of the project study area, as I said, there's 2 countries, Myanmar and Laos. So these are countries in Southeast Asia, bordering Thailand in the middle. So Myanmar, we focus in the Mandalay and Sagaing region. And also in Laos, we focus on the 3 provinces, Sieng Khong, Savanakhet, and Champasak. And those are the areas that have a high concentration of the large ruminant density, and hence this our target area. So starting at the output 1 of the project, which is to look at the FMD risk assessment in the 2 countries. So basically, the project starting with analysis of the existing data in the that's available within the country, and perform the spatial risk assessment, looking at some criteria such as like the previous FMD outbreak information, large ruminant population density, which is focused on the cattle and buffalo, and also distance to the primary road or distance to the livestock market that's available in the country. And those information were like used, use for the spatial risk assessment and information to inform and determine the FMD high risk and low risk villages for the risk-based partial vaccination campaign. Right, so that leads on to the output 2, which is after we have that information, we develop the concern strategy and implement in the target areas, right? So that's through the FMD vaccination campaign and also awareness campaigns in Laos and Myanmar. This summary in this orange box here is that we work in combination with 2 countries, 5 provinces or region. That's under the 5 provinces or region, we work in 47 townships or districts, and within those 47, the total village that we reach is 2,212 villages that involved. So you can see in the photo here that we provide that we run the field vaccination campaign 2 times a year during the life of the project, and in addition to that, we also have produce a awareness material or the billboard that's shown in the project area, and also the have it publicized on the news or television program in the country as well to increase the awareness and knowledge. And just to mention is that the FMD vaccination campaign is that we target on that high risk villages, but not in the low risk, but the awareness campaign is throughout the project area. So basically to monitor this and to understand the impact, we conduct the field survey at the start of the project 2016 and 17 to get a baseline information of the FMD prevalence in the country, and also we did it again at the end at the 2020, and basically we would like to try and compare the data between the start at the end, and also compare between the targeted and non-targeted. And unfortunately, these 2 surveys we can only done in Lao PDR, and in Myanmar we can only do the first baseline survey, but for the end-line survey we couldn't do due to for the pandemic situation and also the political unrest in Myanmar that stopped us doing the end-line survey. So we didn't have the data to compare for the completeness for Myanmar. So basically this survey, we look at the FMD serology, we look at the frequency of clinical FMD occurrence by asking the animal owner. We look at the impact of FMD on their production, and also look at the knowledge and awareness for the farmers, by doing the questionnaire interview. And also we do the post-vaccination monitoring as well using the ST ELISA. Yep. So I just go through the main result or the vaccination impact of these studies, and we found that basically we found the vaccination impact on clinical FMD as shown in the example here in Laos, that the vaccination could reduce the clinical FMD, and that's also we see that when the vaccination number go down in the middle, if you see this graph here, that the clinical FMDs kind of come back toward the end of the project. And this has been published in the paper that I put the reference here as well, if you would like to know more about the detail of the study. And similarly, even though we cannot do the inline survey for the Myanmar, we also observe a similar thing, that the FMD incidence in the project area has been reduced in the project area. And we found this from the community animal health worker survey validation in 2018, that when we still can get some information from the field, that 98% report that they have not seen FMD since we start the vaccination. And we also have a really good record from the PVM 2018 as well, that the number of vaccination coverage for Myanmar is so high compared to Laos as well. And I think that's gonna support the result that we're showing here. In terms of the socioeconomic indicators, we also found that there's an increased contribution of the livestock production to the household income from our project. So that we observed the 5.8% higher net gain, which is equivalent to 218 USD dollar, in the target villages in the household per year, in 2020 compared to the non-target, right? And we didn't see that difference in the 2016. And again, this work has already been published in the paper that I show here, and you're welcome to look more into details of the study that we have done. In terms of the FMD knowledge and awareness that we get the information from the interview with the animal owners, we found generally improved in 2020 compared to 2016, and that's in Lao PDR. And we noticed that they were able to recognize FMD clinical signs better, and they also have a better knowledge in terms of the spread mechanism of FMD, so that they can protect their animals better when they know how it's spread, and they can stop that. And in terms of the outbreak response, we see a significant increase in terms of animal owner can perform their own natural treatment, using the oriental medicine that they have available on hand, and they also know how to separate the sick animal from the healthy animals to help reduce the disease as well. In terms of the post-vaccination monitoring, we use a structural protein ELISA to test on that on the 3 serotype that we vaccinate the animal, serotype O, A, and ACL1, right? And overall, we found an increased herd and animal immunity to FMD in both Lao PDR and especially in Myanmar. Like for Lao PDR, we found an average of 62% animal immunity in the target village in Lao PDR, and this come from the NSP negative animal as well. So we confirm that this is the real immunity that come from the vaccination, and also we observe a higher percentage in Myanmar, 72%, in terms of animal immunity that increased due to the vaccination campaign. Right. Next, for the output tree that we have done the training and also provided technical assistance to the target country, and also extend to the regional, like the CC FMD member country as well. The main activities that we have done is that we develop a cascade training, FMD control training modules for the veterinary paraprofessional in the countries, which is we develop it in line with the VOA colleagues and also the VOA competency guidelines for the veterinary paraprofessional as well. So basically, we have developed the manual for the level 2 trainer who will become the trainer, and also the booklet that's available for the community animal health workers as well that they can use in the field. And those are available to Myanmar and Laos, and it's been translated to the local languages as well. So those are the products that's available for them. And also within that information, we also develop FMD training modules for the farmers as well to increase their awareness. And as I provide a summary here, that in total for the 2 countries, we have trained 2,029 veterinary paraprofessionals in the 2 countries, and overall 27,000 farmers has been trained. And those are the photos of the activity here that we, during the training that we provide, we have like an in-class training or the field training that we do, like animal restraint for the physical examination of the animals, and also for the vaccination. We also train them on the biosecurity when they visit the farm or leaving the farm. And also like we have like a group trainings to increase the awareness for the farmers. Right. So for the impact of the training, we observed this from the survey in 2020 in Lao PDR on the in the veterinary village workers. And the graph that I show here, just would like to focus on the one that show the red bar, which is show the significant difference. So overall, in terms of the FMD, we found that VVW, they are promoting the farmers for the FMD vaccination. They're advising the farmers more about the FMD treatment. They do more personal hygiene to prevent the spread of FMD, and they report the FMD suspected case to the district officer. And also they more aware about the FMD vaccination, detail like the route, the dosage, or to maintain the cold chain. And they are able to advise the farmer for the risk of FMD. And in terms of security, they are able to advise the farmer about the preventive nature. When the farmer introduces the new animals, they participate more, in the vaccination campaign, the outbreak investigation, and they also do more of the cleaning and disinfection of their equipment during the field works. And I think those are the impact that we found from the training that we have complete for them in the project. So apart from that, we also have the offshore training program that we bring the key government veterinarian from the central office. And this also extends to other two countries as well, not only Laos and Myanmar. We also have the vet from Cambodia and Vietnam to come each year in 2017 to 2019 to do a 4-week course of basic epidemiology and data management training. We also have 2.5, 2.5 weeks intensive lecture and hands-on exercise in the computer lab on the EP and data analysis. And then they also have 1.5 weeks for them to work on their own data and conduct the project work related to FMD in their country. And we also had a final evaluation of the project presentation at the MPI Animal Health Lab in Wallacefield as well. So the work can be also shared with our MPI colleagues who also work alongside with us in the project. And the participants also have a chance to visit the Animal Health Lab and see the facility that New Zealand has as well. In terms of the emergency response procedure, we also did provide outbreak investigation training in the country, which in 2018, we conduct the field training in Laos and Myanmar. And after that, we kind of got limited by the pandemic. So we have converted the training and develop training of trainer of outbreak investigation and response on the virtual. And we have done that last year in 2021, and this has been expanded to other CCFMD member countries as well, about 10 countries. And we have seen that the application of training in practice as well, that the people in Myanmar and Laos have used that for the outbreak investigation of FMD in, for example, in Myanmar and the Rakhine state, on the west side, and also for Laos, they have used that for other provinces. And also, we also see that the skills has been extended to investigate other emerging disease in the country, such as African swine fever and lumpy skin disease in Laos as well. So, and as I just mentioned, during last year, we had the pandemic and we couldn't travel. So a lot of the activities that we have to convert, we couldn't do the field work in Myanmar, and we convert that to the capacity training program, and we develop and deliver for virtual training during 2021 to 2022. And those are the link. Each of them, I also provide a link on the OIE BOA website that can be referenced as well. So basically, we did training of trainer on outbreak investigation, 21 participants from 9 countries. We did advanced GIS training with the focus on the spatial risk assessment and cluster analysis on the for 31 participants from 10 countries. And we deliver epidemiology study design training for 34 participants in 11 countries. And also the infectious disease modeling training that we deliver to 40 participants from 12 countries as well. So that's kind of some summary of the intensive training that we deliver in the past 2 years. For the output 4 of the project, in terms of coordination of the workshops and resource material provided, so we at EpiCentre, we contribute to participate or help the OR colleagues to organize in total 29 regional workshops and trainings, 36 national workshop and trainings, and 25 sub-national workshop and trainings. So basically, this our OR colleague in the Southeast Asia, the one who organized this activity, and we at EpiCentre provide the technical advice or material to assist with those workshops. For the output 5, for the monitoring and evaluation, and also establish the modeling tools. So basically, we have developed the tools for the assessment of the disease status and control. So we have conduct in-country disease monitoring and surveillance training and evaluation, and the output of that, we have developed the guideline for the disease monitoring and surveillance for Lao and also for Myanmar. And again, those are available for them and being translated into the local languages as well. Can be as a reference guideline for the 2 countries. We also developed the online database using the IRIS, and those are also available for them to record the country, record the outbreak data and also the vaccination data. And we also developed the post-vaccination monitoring guidelines, or PVM, for the 2 countries as well. They can use for the future. And for the modeling study, we did conduct the animal movement study to get a better understanding of the contact pattern and livestock movement between the village and district, and also get the parameter in terms of like frequency, distance, and the direction of the animal movement for both Lao PDR and Myanmar as well. This has been used for the development of the spread modeling using the interspread class. So in terms of the animal movement study, we have already published for the study in Laos as well, in case you want to see the reference here. And basically, we use that information, and now the modeling has been developed and can be tested on the different scenarios, as we shown as an example here for both Lao and Myanmar. So just to summarize the key achievements, we go through a lot of outputs, and I think basically what we found is that the project is that the locals now are available to investigate the disease emergence and respond, and this can be also applied to other disease, not only FMD as well. And that the key individuals have skills in study design, data analysis, and able to use GIS. And they have developed the survey expertise, also laboratory testing capability and disease surveillance. And also there's an extension of training for the stakeholders and farmers that, the in-country also have the initiation to expand those training to other area that is not the project area as well. So we've seen that's really good outcome. And we have the strategies for the risk-based vaccination for FMD that's been developed and tested for the 2 countries. And also we have the disease modeling and scenario testing that been demonstrated and now available for Laos and Myanmar as well. And the other key achievement is also that the data that we have from the project in Laos and Myanmar has been used to develop the risk-based strategy or RBSP plan for the Laos and Myanmar, and both countries has moved up from the PCP level 1 to level 2 now. And they will carry on to move forwards, following this framework to get a better control of the FMD. So here are the list of the project publications that there are 6 of them that currently available now, with the also the work that we work together between EpiCentre and also the colleagues from the MPI and also from the BOA and the local colleagues in Lao PDR and Myanmar. So the lesson learned in terms of the project is that we found that to build like a horizontal capacity of vet service is confirmed as a valuable investment, as we have seen that this training that we provide can be used for other diseases as well, not only FMD, and also that the wide range of the science-based resource methodologies and tools has been developed and tested, and those have become the reference or guidelines for the veterinary service within the partner countries. And in terms of the risk communication and raising awareness is still continue to play a significant role in disease prevention and control strategies. And we think that we need to adopt this measure to suit the habits of the farmer as well, and including the use of like the social media. That's available to us now, and also a whole society approach like public-private partnership that include government, industry, farmers, and traders. We need to use that approach that will contribute to the FMD control and hopefully potential eradication in the future. Last but not least, I would like to acknowledge the New Zealand Ministry of Foreign Affairs and Trade to provide the funding for this study. Also, the New Zealand Ministry for Primary Industry, and these people who are listed here will make a significant contribution to the project. And also our in-country partner, Livestock Breeding and Veterinary Department in Myanmar, Department of Livestock and Fishery in Laos PDR, and also the BOA colleagues in Sub-Regional Representative in Southeast Asia. Thank you for your attention.
Thank you, Art. I really thank you, all of you, to join us. Again, if you want to receive the message directly about our next seminar, please leave your email address to the chatting space. Otherwise, you may leave the seminar today. Thank you for joining us again. Thank you.